All right. So now that we've got your blood pressure, everything's looking fine. We're gonna do a couple of exercises just to strengthen everything down there. So first we're gonna do a couple glute sets. So basically what we're gonna do is just contract your glutes as hard as you can. Just like that, perfect, yep. And then you're gonna hold that for 10 seconds. All right. And then go ahead and release. Good, and then go ahead and do that again. All right, so we're gonna do that 10 times for 3 sets. And release. All right, so now that you're done with those glute sets, what we're gonna do next is kick each of your legs out to the side. So I'm gonna apply a force to the side of your leg, and you're just gonna go against my resistance. All right, so if you wanna go ahead and bring your leg out towards me. Good, just like that, and then I'm gonna push it back in. All right, and we're gonna do 3 sets of this for 10 repetitions. Good, and go ahead and break, and we're gonna do it on the other side as well. All right, and then you're just gonna come into me, perfect. Come back, 2, 3, and again 10 repetitions on each side for 3 sets. We've done that. What we're going to do is work on your mobility while you're in the bed here. So I'm going to ask that you try and do everything on your own as much as you can, but I'm going to be here the entire time to help out if you need any assistance at all. Okay. So just like we had practiced, go ahead and we're going to do the log roll to your side first. So reach on over, good, and then come up, good, all right. And then let's see if we can bring your knees up to your chest to kind of get your legs off the edge here. Good. And then we're going to use this hand to push off the table and your elbow to push off as well. And on the count of 3, we're going to sit up. 1, 2, 3. Perfect. Great. And how do you feel?
Okay.
You feel all right?
Yep.
All right. Well, let's get you back down into the sideline position, and then we're going to roll you over under your belly. All right. So go ahead and just come back down. Good, good. All right, perfect. And then if you want to move your legs back up, good. And then I'm right here. If you're able, we're going to roll over under your belly. And we're going to bring this arm out from underneath you. Good, and try and roll over on your belly here. Perfect, all right. All right, good. Good, good. All right, so now that you're laying on your belly, a couple things I just want to mention is you want to try and get in this position if you can, if it's comfortable for you, just because we don't want your hip to kind of get stuck like this, so we want to kind of encourage it to just straighten out like that. Okay. So another thing that I'm going to do to kind of enhance that stretch is just stretch your hip flexors just very gently. So what I'm going to do is place my arm on your pelvis to stabilize, and then the other arm is going to go underneath your thigh, and I'm just going to gradually lift it up to kind of stretch those hip flexors. Is that all right?
Yep.
All right, so we'll start with this side. All right. Everything okay?
Yep.
All right. Good. And we're just going to hold this for 30 seconds for 3 sets on each side. Good. So we'll go over to the other side. Any pain?
Nope.
Nope. All right. Good. And again, we're going to hold it for 30 seconds for 3 sets. All right. So now from this position, we're going to have you roll back onto your side. And then before you do anything, you're just going to stay on your side. I'm going to go around in front of you, and then we're going to get you back up to that seated position. All right, so let's roll over onto your side here. And again, try and do it as independently as possible. All right, good. Stay there, stay there. All right, and then we're going to scoot closer to the edge here. Perfect. A little bit closer. And then again, we're going to go up into that seated position. 1, 2, 3. Good. All right, perfect. And everything okay in this position?
Yep.
All right, so from here, So from this position, I understand that you're getting pretty good at transferring to your wheelchair now. So again, I'm going to be here to offer any assistance at any time at all, but I want to see if you can try to do it as independently as you can. So go ahead. Good. Good. Great. Perfect. This out of the way. Go ahead and get situated. Wonderful. Awesome. How do you feel?
I'm okay.
Good. Perfect. Well, that was great. So we're going to go transfer back. So if you want to lean over to this side, we'll get this under your here. And again, I'm going to be here to help out, but try and do it on your own as much as you can. Wonderful. Awesome. Good job. All right, you feel okay? All right, so we're gonna get you lying back down. I'm gonna take your blood pressure and then we'll call it a day.
That's good.
All right, so bring your legs back up. Good. And then we're gonna roll back onto your back. Good. All right. And are you comfortable, everything? You need an extra pillow, anything like that? You're good? All right. All right, perfect. And you don't need any extra pillows or anything like that?
No, I'm okay.
You feel all right? All right. Well, have a good rest of your day, and I'll see you tomorrow.